Welcome to the Deep Dive. Today, we're diving into something really critical, often overlooked in healthcare. Imaging care for transgender and gender-diverse patients.
That's right. We're looking at best practices and recommendations, drawing heavily from that 2023 paper by Kyrazis and colleagues.
And our mission, really, is to explore how radiology departments can become genuinely inclusive, respectful spaces, making sure everyone gets the care they deserve. Because here's a pretty startling fact to kick us off. Did you know that transgender and gender-diverse, or TGD, patients actually report more negative experiences in imaging compared to general health encounters?
Yeah, the numbers are quite shocking. We're talking over 70% reporting negative imaging experiences.
70%. Compared to what, about 33% in general healthcare? That's a huge gap. Let's unpack that.
Well, that gap points to a really profound issue. TGD individuals already face significant health disparities. I mean, the source notes a striking 23% avoid necessary medical care altogether.
23% avoiding care. Mostly due to fear of discrimination.
Exactly. And in radiology specifically, this translates into real problems. Things like diagnostic errors because staff might lack knowledge.
Can you give an example?
Sure. The paper mentions potentially overlooking pregnancy in a transgender man who presents with abdominal pain. It really shows how this sort of rigid binary view of gender can directly degrade the quality of care.
Wow. And that links to another statistic that just jumped out at me. 1/3 of TGD patients feel they actually have to educate the imaging staff themselves.
1/3. Just to get appropriate care.
I mean, beyond the obvious discomfort for the patient, what does that say about our current systems, our training? It signals a clear need for improvement, right? A real opportunity.
Definitely. And we can see this clearly if we follow the typical patient journey. The best practices really need to start before the patient even arrives for their exam.
Okay, so before the exam, what's key there?
Language, first and foremost. Using a patient's chosen name and their personal pronouns, they, them, zezir, whatever they are, is absolutely critical.
And the paper stresses not using the word preferred, right?
Exactly. They aren't preferred. They're just personal. They're the correct ones. And, someone slips up, makes a mistake. A brief apology, correct yourself, and move on. Don't make a big deal out of it.
Right, because long apologies can actually make it more awkward.
Precisely.
Okay, so names and pronouns. What about the administrative side? Like scheduling, records.
Yeah, electronic health records, the EHR systems, can often store sexual orientation and gender identity SOGI data. But, and this is a big but, staff need training on how to sensitively ask for this information and how to actually use it correctly.
The paper had that vignette, number 1, I think, about the transgender man needing a mammogram.
Oh, yes. He received a pink informational guide all about breasts and was directed to women's imaging.
A perfect example of that disconnect. It just highlights why things like patient instructions and even department names need to be neutral.
Absolutely. Use gender-neutral terms like patient or person, and anatomical descriptions say chest imaging instead of breast imaging, if that's what the patient indicates.
Makes total sense. Okay, so moving to the day of the exam itself, the environment matters.
Hugely. First impressions count. A welcoming space can really lower anxiety. Think about visible non-discrimination policies, maybe staff wearing pronoun badges, affirmative symbols like rainbow flags.
And there was another vignette too, that really hit this home. A transgender woman called from the waiting room by her legal name, not her chosen name.
Yes, and she felt such intense embarrassment, she actually considered just leaving without getting the exam.
That's just devastating. It really shows how deeply personal and potentially fraught these interactions can be. What about the physical space?
Also important, things like single-user, all-gender dressing rooms and restrooms are best practice, offering gender-neutral gowns too.
And you mentioned trauma-informed care earlier. That seems crucial here.
It is. Especially given that estimates suggest around 50% of TGD individuals have experienced some form of trauma. Staff need awareness and training in trauma-informed approaches.
Which means what in practice?
It means explaining procedures really thoroughly. And critically, empowering patients, giving them a sense of control. The paper suggests, for instance, maybe inviting the patient to help guide an endoluminal probe during sensitive exams, like a transvaginal ultrasound.
Right, that example ties into vignette 3, the non-binary patient feeling anxious during that type of ultrasound, partly because of misgendering and feeling a lack of control.
Exactly. It makes a tangible difference.
So then, during the actual image acquisition, the exam itself.
Respectful acquisition. Basically, avoid irrelevant questions. Staff shouldn't be asking about a patient's intimate anatomy or their surgical status unless it's directly relevant to the scan.
Stick to the medicine.
Right. And always ask about terminology. Do they prefer chest or breast? Offer chaperones for sensitive procedures as standard practice.
Okay, and after the exam, the reporting phase seems like another potential pitfall.
It definitely can be. Gender identity should not be included in radiology reports unless it is medically pertinent to the findings. Misgendering in reports happens.
The paper said it affects about 1 in 4 TGD patients.
Yes, 1 in 4. And that can lead to errors, distress, confusion down the line. Vignette 4 was powerful here, too. A transgender woman's report wrongly mentioned she'd had a hysterectomy.
Wow.
Absolutely. Comprehensive training modules covering TGD health basics, implicit bias, even bystander intervention techniques. These are shown to be effective and really should be standard.
And policies that protect both TGD employees and patients. Things like guaranteeing use of correct names and pronouns, ensuring access to appropriate facilities.
Yes, it creates a culture of safety and inclusion. It's foundational.
So connecting all these dots, what's the bigger picture here?
The bigger picture is that radiology really has a clear roadmap now. We know how to provide truly inclusive, patient-centered care at every single step of the journey. It's fundamentally about respecting a person's identity just as much as we respect their anatomy.
So thinking about what this means for you, our listeners, what really stands out is that these practices aren't just about being inclusive in a sort of abstract way. They're actually essential for diagnostic accuracy and patient safety.
That's a great point.
I mean, when a patient feels genuinely seen, respected, safe, they're far more likely to share crucial, accurate medical history. And that directly helps prevent the kinds of diagnostic errors we talked about earlier.
Better communication leads to better care.
Exactly. So this isn't just about, niceness or political correctness. It's about fundamentally better medicine.
Yeah.
For everyone. We really hope this deep dive has given you some valuable insights into how we can foster truly inclusive care in imaging and beyond.